When a doctor wants to find out more about a patient's illness or condition, they refer them for diagnostic tests, MRI scans for example, ultrasounds or endoscopies. Under Welsh NHS standards, the maximum time a patient should have to wait for these tests is 8 weeks. But over the last 2 years, the number of patients who have had to wait longer than 2 months has gone up and continues to do so. In November 2011, the figure stood at just under 7,500. By November 2012, it had climbed to over 15,000. The latest figure for November last year stands at well over 23,000. Over the last 2 years, the number of patients waiting over the maximum time has more than trebled. And analysis by BBC Wales clearly shows that patients here are waiting significantly longer for a whole range of services than patients across the border. 1 in 3 patients in Wales waited longer than 8 weeks for an ultrasound scan, for example, compared with 1 in 1,000 in England.
There's some excellent treatment and there's some very excellent speedy treatments in place across Wales, but they're almost cancelled out by the negative experiences that, of course, hit the headlines more than the good ones do. But it's the equity of treatment that any system actually must strive towards. So targets are an indicator, and failure to meet those targets needs to be analysed very, very carefully to see where we're going wrong.
The Welsh Government has previously said health boards are working hard to address backlog issues, but these figures are the latest in a series of targets that have been missed by the Welsh NHS. Yesterday's statistics showed the number of patients waiting longer than they should to get access to hospital treatment had reached record levels. But the Welsh Government has suggested the current targets don't give a complete picture. The Health Minister is in the process of reviewing them, saying they don't always indicate what's best for patients.